Heavy menstrual bleeding is really in the eye of the beholder. The definitions have changed over time, so what we use for research is a certain amount of bleeding, but the definition now by ACOG, the College of OBGYN, is really any amount of bleeding that interferes with a woman's quality of life. Heavy menstrual bleeding is a common complaint in the office. What's really important for us to understand, though, is that there's a very large majority of women who experience heavy bleeding who never complain about it. So many doctors think that our patients want never to have a period again. It's a very important question for us to address with our patients because culturally, many patients actually want at least a little period. They want to know they're not pregnant. But there's also a cleansing sense of having a regular period and also being a woman. So it's important for us to ask our patients what their goals are. And if she's still interested in retaining fertility, then my armamentarium is different than it will be if she's completed childbearing. My approach to heavy menstrual bleeding is really to start with the most straightforward and simple and go from the least expensive, least invasive to whatever else I need to do, and it's based on her goals. Some will say, I never want to bleed again in the rest of my life, and that option is hysterectomy, right? There's no other procedure that I can do that offers a patient that guarantee. But if I take the uterus out, then she's not going to bleed. For women who have a relatively normal uterus and have heavy menstrual bleeding, endometrial ablation is a great option. The Cerene Cryotherapy Device is a huge advance in cryotherapy technology. By creating a liner that conforms to the cavity of the uterus and then deploying the nitrous oxide that allows for very uniform freezing. This is so well tolerated. We put an ice pack on something that's hurting because it numbs the nerves, they no longer transmit, and so it reduces pain. The most compelling things about the Cerene Cryotherapy Device are, number one, the ability to do it in the office. My office is where she's comfortable. She knows the staff. She knows what to expect. She knows where the bathroom is. She knows everything about where to park her car and how long things are likely to take. So for a patient, it's a much more comfortable experience even before we talk about the procedure. From the physician's standpoint, the efficiency is unbelievable. So if I have to leave my office and I have to go someplace, the likelihood is I have to wait my turn. Most importantly, from a medical standpoint, is that cryotherapy preserves access to the uterine cavity. Burning and heating technology creates fibrous bands and adhesions or scarring. Freezing technology is quite different. We don't end up with scarring that blocks off some little islands of endometrium that cause delayed episodes of very severe pain. And importantly, from just a medical standpoint, if she has episodes of bleeding later on in life, we can very accurately assess the uterine cavity. We can reassure her about what's going on. We can treat her properly, and we can reduce the number of hysterectomies that have to be done because we can't access the cavity. Access to the cavity with cryoablation is really a key point for me. And that was why I loved cryotherapy from the very beginning.